Certainly no secret that the last few years of the pandemic have certainly taken a toll on Americans' mental health.
Yeah, joining us today to talk more about the signs of mental health crisis and how to take action when seeking care is Anne-Marie O'Brien, the Regional Wellness Director at United Healthcare. Anne-Marie, thank you so much for being with us.
Thank you for having me today.
All right, so how would you describe the current state of mental health in the United States at this point?
It's a great question. I think what we're seeing is that the public is struggling. We've spent since March of 2020 in the midst of a global pandemic, and that people have starting to come out of it now, and we're seeing not only the financial toll of it, the physical toll of it, but the mental health toll that we're seeing. And this crisis started before the pandemic, but it's really become evident during the pandemic. We looked at a Boston University School of Public Health study that showed the rates of depression have skyrocketed during this pandemic. It went from a rate of around 8%. Now it's being measured at 27.8%, almost triple the numbers. And 1 in 3 Americans are identifying as being in some form of depression at this time, which the numbers are astronomical.
So, you know, the good news is, I guess, we're becoming more aware of it, but is there still a stigma surrounding it? And how do you break down those barriers so people can get the help they need?
Absolutely. We've made great progress, and we really are seeing many multifaceted approaches to breaking down the stigmas, but they are still there. People are afraid to talk about mental health and well-being. They're worried about being labeled as being somebody who has a mental illness, and the impact that it will have, not only on their everyday life, but on their job security. Could they lose their job? Will their workplace find out about it? Once we can break down that stigma and really talk about it openly, the other areas that we need to focus on are access to care.
Yeah.
People knowing that they have these services available to them. 3/4 of the time, that's the biggest battle is, did you know that you have access to this, whether it be an EAP at work or a mental health provider,
Right.
And getting people the assistance they need to go and get these services.
You know, I'm sorry, go ahead, Anne-Marie.
It's really important to talk openly about this.
Absolutely. You know, and I talk all the time about my therapy trips to my doctor. I'm a proud proponent of getting therapy. I think everybody out there, if they have, you know, they should certainly take advantage of it. What are some of the signs that you or a loved one might be depressed, or, you know, that they could need help?
The signs and symptoms can be different in every person. It's really about looking at that person and talking to them. Typically what you're going to see is somebody that's experiencing depression. It's over a period of time, that helplessness, that hopelessness, that being downhearted. Other components to it that you need to worry about are the excessive mood swings, alcohol abuse, drug use, you know, the excessive conditions from one extreme to the other. Focusing on things like eating or spending money are also typical signs of it.
So oh, go ahead, sorry.
And constantly, you know, feeling isolated, for that person to isolate themselves.
So once you know that you need help or your loved one needs help, what are the first steps to get some action?
Really, what you want to do is call your primary care physician. Start there. Your doctor is your first line. They're there to assist you and to guide you, whether it be talking to your primary care physician or being directed to other areas of care. If you don't have a primary care physician, if you look on the back of your health insurance ID card, there should be a customer service number that you can call. That they are meant to be there to advocate for you. To direct you to providers that are available to you in your area, that are easier for you to access. Talk to your employer. Many employers have employee assistance programs that are underutilized. You can usually get up to 3 visits through your EAP that are easy to schedule and start the process. Obviously, if you're in crisis, those 24/7 hour crisis hotlines are available to everyone and something that we would always recommend.
And
Then in this age of the digital, we have apps available also.
okay. And again, you just mentioned crisis. You don't need to be in a crisis to seek out mental health, right?
Absolutely not. We don't want you to wait till you go into that crisis situation. Mental health should be the same as your physical health, taking care of it on a daily basis, talking to somebody about it, being open about it, and being able to care for your mental well-being as well as your physical health. They are oftentimes tied together.
Yep. Thank you so much. Really important point. We're a whole person. You got to take care of the mental and the physical. They're so connected. For more information, you can visit uhc.com or find United Healthcare on social media at UHC. Thank you so much.